Thank you, everybody. It's great to be here. I want to thank Sam, Chuck, and Scott for the invitation. I'm going to really enjoy this audience because I speak oftentimes now in front of physicians as well as data scientists, and you sort of are in the middle somewhere. So I'd love to just set the framework for what's coming in artificial intelligence in medicine from a physician and a data scientist now perspective. And I'd love to hear some questions and feedback from all of you because you actually are in the middle of all this sort of paradigm shift in healthcare. So I know the title was Dr. AI and the Future of Artificial Medicine, but I think it's just as accurate to say that it's now in 2016 about data and machine learning. And I'm going to be speaking from not just a clinician, but also a data scientist perspective. So since it's late in the afternoon, I have just lots of pictures and minimal text. I'm a practicing pediatric cardiologist with a very busy practice. And I think rather than jumping on board with the data science area, I wanted to stay in practice because I think the pain points are so obvious on the day-to-day level as an active clinician. It was on February 14, 2011. You remember that was the day that, or the night that the supercomputer Watson beat the human contestants on Jeopardy. And I figured I'm a pediatric cardiologist, so February 14th is Valentine's Day, so there was a double epiphany for me that this is sort of the future trend of medicine. The AI has arrived, and this time, hopefully, unlike the previous two times, is going to stay. That was also the night that I downloaded the program application at Stanford for the data science program. So it was a very important night for me. So at the age of 55, 56, I decided to go back to school at Stanford. You can imagine what it's like to go to class with classmates that are a third to half of your age, and your TA and professor still call you Dr. Chang, you know. So it was a humbling experience to go back to school, but you know, my CEO asked me after the first month, what is it like to go back to school, especially at Stanford, learning data science and computer science? I said, it's kind of like you're a average weekend athlete, and now you're playing on the ice, playing Winter Olympic hockey with the Russians. That's what it felt like. So, so that's what it was like for me for 4 years. I'm happy to say I graduated finally this June. So thank you. So day-to-day, what do I face in the clinic and how we can look at artificial intelligence in medicine? So I look at echocardiograms before I go see the patient. Oftentimes I ask the parents, since I'm a pediatric cardiologist, but I also see adults, ask the patients or the families to bring in data in terms of vital signs, blood pressure, and heart rate. I'm embarrassed to say that this is what I get sometimes, not for the parent, but that we're still in a system where this is a big ask. So you can appreciate the coffee stain on the right upper corner there. So we give the same medications for heart failure at the same dose to most of our patients. And we communicate by an occasional text. I know in this room, this is probably very difficult to accept, but you know, sometimes it's still fast to just have a quick text about a certain development. So where I'd like to see this in the future, and I'm happy to say Bill Fiester's here, he's our CMIO. We just launched a more intelligent clinic because we want to push the envelope towards the future, looking at ways you can use artificial intelligence in medicine. So wouldn't it be nice to have wearable technology where all the data, rather than written on a piece of paper by the families, is actually recorded, put into a data repository, and analyzed. I really appreciate the last session because it's a nice segue to everything that I'll be saying. Wouldn't it be nice if we have machine learning involved in the day-to-day or week-to-week different medical imaging studies? Rather than have your cardiologist read the echocardiogram and trying to remember what the last echo showed, it ought to be just automated so that we take advantage of what I call small data. We talk about big data all the time, but what about the individual patient's data? So not to make this confusing, but it's really kind of small, big data. It's your personal big data that is under-leveraged when we go to see the physician. So I totally agree with Jack earlier's comment that we totally need to get machine learning in a big way into every aspect of medicine. Wouldn't it be nice if every patient had a different dose for the same medications or a different medication that's best suited for that individual patient based on pharmacogenomics? And also sensor technology for compliance. And lastly, a big support from AI-inspired educational tools for the patient's families. So how do we get there from here? Well, the first thing I think, how many physicians are in the audience? I'm just curious. Do we, by a show of hands? Okay, a few. So I think the first thing is there's a lack of true in-depth understanding of the different cultures that we face. So among the physicians, we still are operating with evidence-based medicine only, pretty much rely on evidence-based medicine to make decisions. When in fact, if you think about the iceberg visual, the intelligence-based medicine with machine learning and natural language processing, everything that you're hearing about, even in mainstream media, is going to be intelligence, what I call intelligence-based medicine. And that's the 90% of the iceberg underneath the surface that we're not tapping into. When you go see your cardiologist or your primary care doctor, that physician is not tapping into 90% of what's available in terms of making the best decision. Because to make that decision, physicians need to appreciate what machine learning is and what it can do. I gave a talk a few months ago to a room full of neonatologists who are very savvy, data-minded, focused physicians, and nobody in the room really could define deep learning or knew what it was. So that's a room of very intelligent physicians who are data savvy, do not understand what the significance of deep learning would be in the future. So we have a pretty good big size gap. Physicians continue to think that they will always outdo machines in something like reading MRIs. And as you know from Jack's comment earlier, in JAMA just came out, diabetic retinopathy, the fundus photographs, the machines did as well, if not better, than board-certified ophthalmologists. There have been studies that showed also that machines can beat a group of radiologists reading MRIs. So, the physicians kind of need to set aside a hubris that we're better than machines and maybe learn to embrace AI as a partner. Believe it or not, the New England Journal of Medicine, a very well-respected journal, just came out a few weeks ago with its first article on artificial intelligence application medicine. We're still waiting to hear from JAMA. We're still hearing from Lancet. So these are the journals that physicians are reading week to week. There's no exposure or education on what's happening in the real world with artificial intelligence. So you can say that pretty much medicine and healthcare are a decade or two behind the business sector as well as the sports sector in our application of artificial intelligence. And of course, there's this push to compete against each other, which for a data scientist is a little bit foreign because data scientist is all about collaboration and open source software. We're competing, trying to get on this ladder of which hospitals rank number one, when, in my personal opinion, so this is a caveat, we really should be ranking diseases that we want to solve rather than the hospitals. What good is a hospital being ranked number 13th versus number 11? It really, I think, behooves us to rethink the ranking process. So in terms of data scientists that I had an opportunity to hang out with for the last 4 years, all they want is more data, when in fact, healthcare and medicine may not have the big data that they ideally want, and they may need to reconsider looking at small data. And I'm so glad that Stanford is pushing ahead with a relatively unique way of looking at big data, which is take small data, and it's called one-shot learning, and I don't know if anyone here has heard of it, but it's really looking at small amount of data and making inferences based on that amount of data. So the data scientists need to also, I think, appreciate that in healthcare and medicine, there may be just one unique case that you need to learn from, the N of one medicine, as we call it. I think if I could constructively criticize my data scientist friends, often there's a lack of understanding what we really, truly need in medicine and healthcare. They're usually about decision support tools, when in fact, As you heard earlier, 90% of what we need on a day-to-day level and problems you face is really workflow, data flow, communication, access, efficiency. So maybe that doesn't sound as sexy, but the thing is, that's what we truly need to improve healthcare. So I suggest to my data scientist friends to spend more time looking at the true needs of clinicians on the ground. Another problem is the confusion between causality and evidence, and how we look at something that's associated but may not be a cause of something. But I have to appreciate the data scientist's penchant for really collaborating and opening up the data, which I hope the healthcare and medical stakeholders will eventually get to. So take-home message number one is the cultures on both sides, I think, really need to be understood and reconciled before we move forward in the area of AI in medicine. What I learned at Stanford is the AI methodology is actually pretty mature, but what's happening in healthcare and medicine is that the data culture is really, really behind. The second area I'd like to explore is what's happening in AI and healthcare. This is a graphic that everyone in this room will understand, is that artificial intelligence is really sort of at the top of the pyramid when you talk about data, information, and knowledge. So, and obviously, it's transferable. This is the public perception of artificial intelligence in healthcare. It's just going to be a robot, all-knowing robot running around the hospital, trying to pretend to be a doctor, and that's how behind we are in understanding of healthcare and AI. So it's rather than the robot, it's really sort of an energy source that is going to be available to, I think, brighten the dark areas in medicine, and that's how I think we should look at AI in medicine. Problems, many, many problems. So one is missing data. I was astounded when I was doing projects at Stanford, how and they have a good database, how much of the data is truly missing in healthcare. That really affects how you data mine a healthcare issue. Also, in addition to missing, well, there's so much missing data. There actually been books, I don't know if you're aware, there are books written on missing data in healthcare. We also have very unstructured data, as you well know. These are beach stones north of here. It reminds me of healthcare data being so heterogeneous, from an MRI to a lab result. It's just very, very difficult to work with. This was mentioned earlier. This is the sign-out note from a nurse practitioner in our cardiac intensive care unit. Information rich, but very difficult to extract that information. And hopefully with natural language processing, that will be a problem of the past. This is another data-rich source. It's the patients and the families. This is a data-minded parent that wanted to help me make a difficult decision about timing of surgery. And he not just recorded, but plotted the information for me. It was very easy for me in clinic to make a decision about what to do. So the parents and the families are very interested in helping with the data source. The problem is also medical information is escalating, as you well know. There's 200 times the medical information that any single physician can digest right now in 2016. So it's just impossible to keep up. And it's doubling every few years. The future data tsunamis, as I call it, are going to be the wearable technologies and genomic information. If we sequence every human being on the planet, where are we going to store that information? How are we going to analyze that information? It's going to be a future challenge. So the data tsunamis are in fact coming. So, and then the last issue is the fragmentation of data. So if you think of AI as a rocket that's being built and ready to launch, the problem is not the rocket isn't ready. The problem is that this is where the rocket fuel, or how the rocket fuel is being stored in little tiny containers with individual patients or institutions are not willing to pull it together to launch this rocket. So as I said, the problem is the data part, not the AI part necessarily. And I'm glad we talked about a little bit about the security of data, and totally agree that blockchain has a potential to solve some of the headaches of data security and HIPAA issues. So it's quite a conundrum in data healthcare to move ahead for the AI part to really yield very meaningful results. So the second takeaway is that I think data needs to be improved and shared amongst all stakeholders. And I think it sounds easy and makes a lot of sense, but the execution of this is going to be challenging and will, I think, provide a challenge for the next few decades. Lastly, talking about data and databases, I think where we need to go with AI and healthcare is we need to rethink the structure of data and databases. We're still in the relational database format, very, very few sort of adventures into graph and hypergraph databases, which is, I think, ideally suited for healthcare with its complexity of data. That's how we're going to, I think, be able to couple that with deep learning so that we can actually individualize medical therapy. And as you know, deep learning and reinforcement learning played a big role in the defeat of the human Go champion a few months ago by Google's DeepMind. So as soon as I heard about that and learned about the deep mining and the reinforcement learning concepts, the first thing I thought of was this is ideal for medicine because medicine is so complicated with so much data, and yet week to week, month to month, clinicians need to make decisions not knowing what the future is going to be. And that's exactly what DeepMind did to beat the human contestant. So it'd be very interesting to see, I think, the future development of this technology into the medical world. And I'm really glad that Google is leading the charge in that area with deep learning. So in essence, we're talking about AI in medicine or medical intelligence and all its component parts. So very quickly, there are over 100 now AI and healthcare-related startups. So and accompanied by a pretty robust increase in venture capital. So this is a great time to not just learn about AI in healthcare, but get involved and start using the tools that are available. The way I look at AI in healthcare, because I get often asked, give us examples, tangible examples. So the way I do this is sort of break it down to 6 main categories. There's some miscellaneous categories I'm not going to have time to go over. One is decision support and hospital monitoring, by far the most popular area for data scientists and people who are interested in mining data, but not necessarily the most supported in terms of venture capital. This is a typical example of such a device. It's a decision support tool that uses not just the ICU or monitoring data from the hospital, but uses all of the pooled data from all the hospitals. So it's very effective, and this is actually one of our intensivists actually using a tool that was set up thanks to Dr. Fieser's team. This is the hottest area by far right now in terms of venture capital, as well as the startup deals that have been made in Silicon Valley, is medical imaging and biomedical diagnostics. And the reason is that for radiologists, pathologists, cardiologists like myself, we're just inundated with medical imaging, and we really need the support of machine learning to detect small differences that are very, very difficult. So this is a very hot area right now. Just to give you a small example how powerful this tool can be, this was actually one of my Stanford projects. It's always been a dream of any cardiologist to be able to not just look at an MRI and not just look at an echocardiogram like you see here, but what if you could see both at the same time? Never been done. Thanks to a little MedLab programming, that's what it looks like. So there are a lot of possibilities in medical imaging and biomedical diagnostics that are going to be coming in this coming decade in the area of AI in healthcare. Another very robust area in terms of investments and what you likely see sooner than later is the area of precision medicine drug discovery. So without going into a lot of the details, it's basically trying to individualize therapy for most of the diseases that we face. Cancer and cardiovascular disease are still will be the number 1 and number 2 disease burden for a long time, and in terms of years lost. So a lot of money is being developed into trying to come up with the concept of precision medicine for the individual patient. So you maximize the yield with minimal side effects. Something that we want to do for decades and haven't been able to do. I think this is the decade that we're going to see impact in that area. You're already starting to see impact in oncology, hopefully soon in cardiovascular health as well. The gentleman at the last panel talked about cloud computing, big data. Absolutely the critical part of moving forward with AI and healthcare and medicine. Without pulling data, there is no AI. Just like without the rocket fuel, the rocket just going to sit there on a launching pad and not do moonshot projects. I guess that makes those of us who are interested in this space astronauts in a way. But digital medicine, wearable technology, you heard about earlier, really, really big in healthcare. It's going to obviate the need of very frequent clinic visits. That's going to be a thing in the past, I think, in this decade. Now, it's an interesting transition period because hospitals are still yielding from frequent visits and use of medical imaging, but as we transition to value-based care, this is going to, I think, really surface as a way to deliver valuable care without more resources. And lastly, the robotics is very interesting, particularly with virtual assistants. So robotics will be involved in not just therapy, but also in the form of virtual assistants will be taking on a lot of the medical education and healthcare education, as well as diagnostics, particularly in mental illnesses in the future. So these are the 6 sort of main areas in AI and healthcare that will be coming in the future. So medical intelligence then still needs, I think, in a big way, humans to come together, collaborate, and find out how we can leverage technology. And I think that's always going to be there. So the last thing I just want to raise is that artificial intelligence sounds nice in terms of the machine aspects, but machines need the humans to get all of this organized and needs to be orchestrated by humans for the long term. So artificial intelligence, again, is really here in healthcare. Unfortunately, there's a misconception of artificial intelligence in general. Even the magazines are pretty good about understanding artificial intelligence. We'll put on the front cover a robot. Harvard Business Review, again, the robot is artificial intelligence. It's such a small part of it. And this is even worse, a little USB port in the back of a human head. But it really, again, is not the robot, even though a robot is part of artificial intelligence. It's really an energy source. It's really a different way to do business as usual. So think of it, please, as an energy source. It's a unique energy source in terms of the dividends. And obviously, as Jack mentioned earlier, machine learning and deep learning particularly are going to be a very, very big part of artificial intelligence in the future. As big as IBM Watson is, I think that's only part of the AI orchestra. There are many, many exciting sections in this orchestra. I think it's going to be the most exciting 25 years in healthcare and medicine to come, without exaggeration. So one of the things that the residents at my hospital always talk to me about is, Dr. Chang, are you telling us that you're going to have robots ready to replace the residents? Well, I show them this picture and say, you're sort of halfway there because everyone is attached to a computer on wheels and you're sort of cyborgs already, so. But obviously we don't want that. I think the best thing about artificial intelligence in healthcare and medicine is going to be freeing the human physicians to go back to what it was before, which is a more intimate relationship with your patients. I think we're inundated with EHR. We need to be liberated from the burden of that work to go back to what we all know that the physicians are capable of doing, which is reassurance and giving hope. So the simple way, if you didn't follow what I talked about in the last 25 minutes, the way I look at artificial intelligence, and not to be very cute about this phrase, but it makes the visible invisible. So hopefully in the future, computer on wheels, sort of desktops in hospitals will be a thing in the past, and that we basically function without the hardware and the equipment. So it'd be nice to make the visible invisible. At the same time, the corollary is true also. This is myself rounding with a group of data scientists at the hospital. A little scary for some kids the way they look, but so we wear a different lens when we look at medicine, a data science or artificial intelligence lens when we look at medicine, and that's the exciting part. So we can actually make the invisible visible. So everything that's embedded and buried in medical data that we need to know and learn about our individual patients' best therapy and best diagnostics is going to be made visible because of deep learning and the many, many other techniques that are coming down the road here. So I'd like to just put in a plug for a meeting that's happening next week. I know this room probably will be particularly interested. It'll be the first of its kind in terms of a multidisciplinary international meeting focusing on AI in medicine. We're going to talk about not just deep learning, but also blockchain, IoT, IoE, all the things that are coming in the future. It's a 3.5-day meeting with a workshop day on Monday of next week. It's right down the road here in down the Pacific Coast Highway at the Laguna Niguel Ritz-Carlton. The best of the best are coming. 50 people from around the world are going to be talking about AI in medicine. We have a lot of young people with abstracts to be presented, and those are some really good ideas for the future. And I'm very, very excited about this meeting coming up. Literally, the best people I can call on, including some of the speakers here, will be part of this faculty. I think you'll learn a lot in 3.5 days about AI in medicine. So I want to just thank the generous Sharon Disney Lund Foundation that gave me the support to launch this institute, and my many collaborators at Children's Hospital Orange County, as well as my very, very, very patient mentors at Stanford, getting me through the program, and the wonderful people at Chapman Computer Science Department that continue to work with me, and the so many great people I met along the way on this wonderful journey to bring in AI in the healthcare and medicine arena. So thank you very much. Okay.